morning. My name is Aram Nerpouni, President and CEO at BioEnterprise, and essentially our role is to help entrepreneurs create companies, find funding that drives the creation of jobs and helps have a positive economic impact in the area in which we work. And we're very fortunate to have partners like university hospitals, the Cleveland Clinic, Case Western Reserve University, and the Metro Health System who help drive all of this activity from a healthcare innovation standpoint. If I think about what my job is in simplest terms, I realized early on that I was a cautious entrepreneur, which means I'm actually a pretty terrible entrepreneur. And what it turns out though is that I'm a pretty good entrepreneur enabler. And what that means is, if you imagine when you're with a group of friends and there was a jump to be made or a climb to be made or some kind of dare, I was always good at figuring out what the risks involved were, what the good outcome might be, what the bad outcome might be. But there was always some kid in the crowd who with a gleam in their eye would say, I think I can do that. And so it was my job to say, I think you can do that too. And so that's really what happens with entrepreneurs. It takes a very bold act to be an entrepreneur, to quit a job, to risk your own personal savings, to move, to do something very different. And so when someone comes to me and says, hey, I've got this great idea for a company or for a new product, and I think I can do this, my job is essentially to say, I think you can do this too, and here's how you can do it. And so today what I'd like to do is kind of walk through 3 trends in healthcare overall. And at the end of that, I think it'll be clear that to be an entrepreneur, to be an innovator in the healthcare space, if you're sitting in this room, if you're watching this at home or at work or on an iPhone or on a cell phone, you today can participate in healthcare innovation. And I'll walk through these 3 trends and then I'll put a challenge on the table for those of you that are watching this. So the first trend is how healthcare delivery is getting closer and closer to the individual patient and where they live and work on a day-to-day basis. And so for a lot of reasons, the cost structure in healthcare has changed over the last decade or so. And in the past, when your interaction with healthcare, once you were no longer an infant, tended to be episodic. You were hurt and needed to go to the emergency room, you had chronic pain and you went to see a physician, you needed surgery, you'd go to the hospital. And so it was a very centralized delivery system. And there were cost implications for that, some good and some also negative. And over time, we'd go to the hospital. Inside this hospital were institutes, departments, and even at an individual surgeon level, they might have different ways that they deliver care and different tools that they use. And over time, healthcare has become a very significant part, absorbing a lot of our GDP. And so there's been this push now to not do things, on a case-by-case basis, but think, from an episodic care to life care. And what this means is kind of 2 things. One, when hospitals are charging for the work they do, rather than charging for each individual process, each individual procedure that they do, they now have a budget to operate within. So whether it's the government or it's large payers, insurance companies, they're essentially saying if someone's having a knee replaced, here is what we think that should cost, and that's what we're going to reimburse you for, and you need to figure out how to make that work. So that's one level where healthcare is changing. 2, they also realize that obviously, rather than waiting until someone had something that was so serious they needed to go to the hospital, if you get out in front of that, if you're proactive about that, if you get into prevention, it lowers the overall cost of healthcare as well. And then last, they realize that patients now have a lot of choices. And so now you're seeing hospitals act as health systems, delivering care not only out of the hospital itself, but into distributed clinics. So you're seeing the cost of healthcare being a driver that pushes healthcare out of the centralized hospitals, out into communities, and it's getting closer and closer to individual patients. The second trend that I wanted to talk about was basically the rise of population health. And all of these trends connect. So now as you start thinking about you're getting into prevention, rather than in the treatment of illness, you start looking at not only the patient as an individual, but you start looking at communities and the impact that they have on individual health. And so rather than following that individual patient, and now there are estimates. Population health is not new; it's been around in variations for a long time, but it's really kind of caught a lot of momentum over the last 5 to 7 years. And what that means essentially is that when you look at what decides whether you're healthy or not healthy, some of that is your genetics, some of that are the personal healthcare choices you make. Do I smoke? Do I drink alcohol? Do I run 30 minutes a day? Those kinds of individual choices. But people estimate that's really only 20 to 40% of what decides your health as an individual. And the balance of that, that's 60, 70, 80%, is really more the social determinants of health. So that's where you live, it's what your job is, who your neighbors are, all of these other things, your socioeconomic class. It's all of these other factors that aren't related to individual decisions you make about your individual health that have an impact on whether you're healthy and have an impact on your cost into the system from a healthcare delivery standpoint. And for a long time, as people thought about population health and social determinants, it was really hard to get answers. What were those factors? How do we measure them? How do we make decisions based on them, et cetera? And that kind of leads us into the third trend, which is we are in the age of data. And so if wherever you're watching this, if you're sitting in a room, if you're sitting at your computer, you probably have an iPhone in your pocket or a Samsung phone in your pocket, whatever it might be, and it's tracking how long you've been sitting, have you been moving around, you may have a Fitbit on. We are awash in data. So we've kind of jumped from one side, we don't have access to data, there's not enough data. We've jumped to the other side where we have way too much data. And so now as you think about innovation overall in very broad terms, go back hundreds of years, 70% of what of the workforce was focused on the collection of resources. Farming, mining, was basically collecting all of the things we needed to survive, to eat, to make tools, to do all of those things. Then came the Industrial Revolution, and so that agriculture, as we got more productive, it's now probably less than 15% of our total workforce activity. Then came the Industrial Revolution, and that became 50% of what we did was making things, and then that peaked around 50%, and now it too is probably below 20-15% of the workforce because of efficiency and automation. The last great wave was around service. So now all of us are consumers. That's the major driver of our economy. It's not just the making of things, but it's the buying of things. It's going out to dinner. It is getting your dry cleaning done. It is all these other things that are out there that are part of the service industry. And that right now is probably 75% plus of what the workforce spends its time on providing. And then there's a little bit inside of that now, within that service piece, that is the data. And it's growing very rapidly. And so now we're at this really interesting time where we have so much information about individual patients, about individuals. You think of Amazon, which in the beginning was a bookstore, then became a distribution center. It's really a data play now, right? It is collecting so much information on what we buy, when we buy it, what we do with it, how often we buy it, all of these things. That just by clicking, going online and clicking, we are sharing so much more information through Facebook, through social media. Think of Uber, which when it launched was a kind of shared taxi service. They're now getting into food delivery. They have incredible information about traffic, road conditions. Again, it's turning into a data play. And so that's really where, for innovators today, having a handle on that data, using data to inform decisions is becoming incredibly important. So this is why I think now the challenge to all of you that are watching this, if you think about how cost is pushing healthcare out into communities and into homes, if you think about how folks have realized that the overall health of individuals is very much tied into the health of populations, and then you think about the fact that data is so readily available. We have too much data. The biggest challenge right now is organizing the data, cleaning it up, really understanding what's helpful. And then finally, if you think about innovation overall, it's what is the problem we're trying to solve? And that's why today, if you think about it, I was a pre-med student in undergrad, worked my way through organic chemistry and physics and all of these wonderful things. And I have great respect for people who continued down that road and became clinicians and researchers and nurses and all of that. But I chose a different path and built a career kind of in healthcare innovation and commercialization. And for those of you in the audience, we need doctors, we need nurses. That's another one of those drivers that is pushing healthcare out into communities because of a workforce limitation in how we deliver care. We still need brilliant people who come up with great solutions to diseases and other big problems. But for others who may not want to be that dedicated to that path, the fact is, because care is becoming more distributed, the work of identifying the problem, what are we trying to solve? What is the problem we're seeing every day? It's next to you, it's in this room, it's when you go home, it's when you go to work. And so that really is the secret of innovation. It's not coming up with a great idea. It's identifying what is the problem, what is the greatest pain point that exists that no one has a solution for, and how do you solve for that? And so for all of you here, you can participate in healthcare innovation. You don't have to be a doctor, that's a wonderful thing. You don't have to be a nurse, that's also a wonderful thing. You don't have to go get a PhD in biochemistry to design the next idea. You can be doing what you're doing every day. And as the population ages, as the health systems continue to push care outside of the walls of the traditional hospital, you are going to be interacting every day. You're going to see your parents grow older. I'm one of those parents that's growing older on creaky knees and everything else. You're going to see, just what's happening in your neighborhood, what's happening in your home, and you're going to be able to come up with ideas for how to solve that. And so it's not a 5 or a 10 or a 15-year journey to be an innovator in healthcare and have an impact, whether it's to create a company, whether it's to have an impact in community health, whether it's to improve patient lives. Today, you can be looking around and identifying a problem. The great thing is the toolbox you need for that, which is not in my toolbox. I was one of those hands that didn't go up for Instagram, Facebook, and anything else, so please don't judge me. But it's essentially, you have the toolbox. I've talked to a number of the Orange High School kids who talked about, they're developing programs right now, software, they are solving problems. So right now, today, you can identify a problem, you can come up with a solution, and you can find a pathway to see that become a company, be an add-on to another product, and you can change lives today. Thank you very much for your time.